So my name is Kevin Gonzalez. This is my patient Julia. She is a minor league pitcher who presents with anterior shoulder pain and weakness after an increased pitching volume over the past 3 weeks. The patient expresses pain flaring up when she cocks back her shoulder during her pitching motions. She complains of not being able to reach overhead when after games and stuff due to pain worsening, but it mitigates itself or lessens when the patient ices. The pain is present when the patient sleeps on the right shoulder as well, and the patient would like to be able to pitch for more than 5 innings at a time and get back to pitching painlessly or pain-free. And the patient has no history of cancer or skin conditions. Alrighty, Julia. So in order for me to find out what's really going on with the shoulder, I want to see what motions aggravate the pain. So for that, I need to touch the area around your shoulder. Is that okay with you? Yeah, perfect. Okay, so we gotta bring up the arm here first. Ooh, a little bit of pain there?
Yeah, just a little bit.
Okay, so a little bit of pain when abducting the arm. Now, I want to ask you to externally rotate your arm for me, please.
I'll tell you right now that it's gonna hurt bad.
So get towards there?
Yeah.
Okay, so pain with abduction and external rotation of the arm. Some suspicions. Alrighty, so we found some pain when she abducts her arm and externally rotates it. So now we're going to be starting a palpation screen. Right, so first we're checking for the temperature. Right. Very nice. Good. Anterior of the shoulder. Calm. I'm checking for some edema. Okay, no swelling evident. Very nice. Okay, so to start off, I'm gonna start with the spine of the scapula. Over here, tracing it back to the medial border. There we go. Inferior angle of the scapula, right here. Right there. Alright, and then tracing that medial border up. We're gonna start with the upper traps. The upper traps goes up here. Any pain with this?
No.
Alright. Very nice. Now, under the traps, right above the spine, is the supraspinatus, right? And I have to go deep for this one. I'm so sorry about that. Ooh, a little bit of pain there.
Ouch.
The patient ouches. A little bit of pain there. So a little bit of pain in the supraspinatus. Alright, so cool. We got the clavicle here. No pain here in the clavicle. Alrighty, now under the spine, we have the infraspinatus, right? Very nice. So in order to check the infraspinatus, I'll have her externally rotate.
Ow.
Okay, all right. So that causes some pain. So my suspicions now are more in the anterior shoulder. And then we have the teres major and minor up here, right? Right in there. Okay. So that covers the back of the scapula. Now we're going to be palpating more the anterior part of the shoulder. Right, we can see the clavicle coming up here. Right, and here we see the acromion. A little bit over here. Perfect. All right, so the supraspinatus comes right in front of the acromion. Okay. So, tender to palpation on the supraspinatus. All right. Now, to differentiate that from the biceps muscle, go ahead and resist my hand. Very nice. Relax. Very good. Testing it. Very nice.
Oh, yeah.
Okay.
That hurts there.
All right. So, in order to specify the supraspinatus for any injury or any tendinopathy of the supraspinatus, I'm going to have her slowly rotate around. Relax. All right. This brings out the supraspinatus tendon right in front of the acromion, and as I palpate here, the patient feels the most pain. All right. Now, something else that I could do to specify the supraspinatus is have him perform a scapula motion. All right. So go ahead and with the thumb facing the ceiling or pointing to the ceiling, go ahead and raise.
Oh, yeah.
Okay. All right. So these are classical signs of some either shoulder impingement or some supraspinatus tendinopathy. So now, since we ruled in that it could be a supraspinatus issue here, I'm just going to test the fascia around it. Right. So going up and down. Right. And then side to side. Good. And then rotational. And the other way. Very nice. Alright, cool. So no results have been found from the myofascial screen. Alright, so your supraspinatus tendon seems to be a little bit tender when to touch. So this is the tendon that helps you lift and stabilize your shoulder once you're in that throwing motion. It is irritated and compressed against the acromion at this point because of all the repetitive and increased motion, volume of throwing. So repetitive overhead motions can usually irritate it, sometimes causing inflammation, which in this time it wasn't present. But we can perform some deep cross-friction massage, right? What that entails is basically just a pinpointed pressure over the tendon and moving it side to side, moving it up and down and circularly. How it works is that that pressure basically recruits some fibroblast recruitment to the tendon, thus producing some healing qualities of it. All right. So to get started on this treatment, what I need to do is to place the tendon or stretch a little bit. All right. So slowly, we're going to bring you back to this position. Perfect. All right. So now, using a pinpointed, I'm just going to apply some pressure right over. Okay. Just relax. Try to relax. Nice. Relax. Alright, how does it feel?
Feels a little better.
So now, I'll ask you to perform the same motion. Just abduct your shoulder for me, slowly please. Alright, bend your elbow. Perfect, and slowly bring it back. Alright, how does it feel?
Feels a little better, yeah. With
Better?
some pressure.
Okay, perfect. Alright.
Cool.